But you always hear about people saying, you know, make sure you have the right tooth because you might pull the wrong tooth. In storms in the doctor, and I can tell she is not happy. Hi guys, welcome back to my channel. For those who don't know me, hi. My name is Melanie Luna Diaz and I am a dental assistant. And unfortunately, I am a dental assistant with a lot of embarrassing, horrifying stories. And actually, for legal reasons or just reasons that I think may need to be put in this video, these stories may not necessarily all be my stories. They might be a friend's or a friend of a friend's. I'm going to talk as if this is all me, but just so you know, this may not all be stuff that happened to me. I'm telling you guys these stories in hopes of making you future dental assistants or new dental assistants feel more comfortable, because I know when I first started and I started making all these mistakes, I felt so stressed and I felt like I was not meant to be in this job because of how much I was messing up. This is just to let you know, you're not alone. We all mess up here. I am now working for one of the top endodontic practices in my city. And you know what? You can make it. Legit, one of the dental assistants that I used to work with, once he found out that I was working for a top-notch endodontic office, he said, okay, well, if you can make it, I can make it. I don't know if that's supposed to be a compliment. One of the first stories that I want to tell you about is the first time that I ever placed topical on a patient. And for those of you who don't know, topical is like Orajel, and it usually goes on your gum area for before you do the anesthetic needle pinch. So basically, at the place I worked at, the doctors would always place it. So I had no prior experience, and then all of a sudden this new doctor comes into my office and he tells me to place topical. I know this may seem kind of dumb, okay? But I had major anxiety about putting topical on a patient because I had never done it before. They didn't even teach us this in dental assisting school, and I know it's dental assisting like 101, but I didn't learn it. But yeah, the doctor told me to place topical, so I put on my confident face. The trick is to look as confident as possible so that they don't know you're a newbie. Okay, so I walked in there, I was looking confident, okay, and I grabbed the topical and I slathered it on those gums, and then I put a little gauze in there, and then I walked out of the room. Okay, everything was fine. I was like, wow, that was so easy. Oh man. But then I came back to the room. This patient was freaking out. And I was like, whoa, what's wrong? And he was like, I was like, what? And you know what? They train us how to do CPR, and they train us how to like do the Heimlich or whatever in dental assisting school, but I was not prepared to do that. Okay, and I was like, what the heck is wrong with this patient? And so I was like, oh, what's wrong? And then he's all like, I can't swallow. And I was like, oh, why can't you swallow? He's all like, that medicine that you put on my gums, it went down my throat and now I can't swallow. And he was freaking out, guys, and I was freaking out, and I was like, and then all of a sudden the doctor comes in. And I was like, oh no, I'm gonna get in trouble. And then the patient is like, I can't swallow. She put that gel in my gums, blah, 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 blah. And then the doctor's like, it's okay. If it goes down your throat, you might feel like that. It's totally natural. And I was like, it's natural? What? And for those of you who don't know, yeah, if Orajel or if the topical cream that we place does go down your throat, it can make it kind of seem like it's hard to swallow, but that's only because it's numbing it, so you can't really feel your throat, which makes it feel like you can't swallow. But that's totally natural, and if you ever feel like that, a simple tongue thrust backwards really helps with that. This patient was still freaking out, so they went into the restroom and then they started to throw up. What the heck? I really thought it was something bad about what I had done with the with the topical jelly, but turns out he was just severely dentophobic. So let's move on to the next one. So Basically, me and a new doctor that came into the practice were doing an exam on a child patient. And this child had a mass, a white pinkish looking mass growing on their gums, on the patient's, on his gums. It's a boy, okay? It's a boy. And we're like, what the heck is that? It wasn't showing up on x-ray. And this was a new doctor. And I don't mean just new to the practice, I mean new to dentistry. And I was new to dentistry, and that does not make a good match. We didn't know what the heck this mass was, and I don't know why I felt confident enough to give my opinion, but I was like, should we biopsy it? And she agreed with me, guys. She agreed with me to biopsy this mass. I go over to my office manager, who was a dental assistant in a pediatric office for a long time. And I told her about the biopsy, and then she goes, why are you guys biopsying a baby tooth? Just pull it out. And I was like, a baby tooth? Did you see that thing? And then she's like, yeah, that's a baby tooth. I was like, what the heck? Okay, for those of you who don't know, I'm going to try to import a picture here, but it did not look like no baby tooth. It did not, but now I know it was a baby tooth. The next story. Okay, so this next one is about an extraction gone wrong. But you always hear about people saying, you know, make sure you have the right tooth because you might pull the wrong tooth. Guys. Moment of silence for all of those who have extracted the wrong tooth, who had done a root canal on the wrong tooth, who have put a crown on the wrong tooth. Okay, done. And I won't say if it happened to me or someone else. Okay, but basically what happened was this patient came in and their teeth were very unkempt. Yeah, let's say that, unkempt. And this patient had severe periodontal disease. Okay, guys, the bone was receding like no one's business. Doctor is examining her. So the dentist starts wiggling this one tooth to see how loose it is, and she pulls it right off. That tooth went yeet. And I'm not saying this is me, but I would have looked at her and she would have looked at me, and we would have both been freaking out on the inside, but remaining our composure on the outside. Okay, so basically the patient looks at this and they're like, what the heck? And then we're like, oh, oops. What can you say in a situation like that? What ended up happening was we just stuck it back in the socket, and we basically just told her it's only there for aesthetic reasons now, since you can't really chew on it or anything else. But yeah, you know what, that tooth would have come out anyways eventually. Okay, so this other one actually caused me like severe stress. So we had a pediatric patient come in and they needed some sealants. And this pediatric patient was very young, to the point where they wouldn't be able to stay still for the whole sealant process, which is why we normally use this material called Fuji. For those of you who don't know what Fuji is, I think there's a couple different types of Fuji, but we used this fast setting white Fuji that we would put on their teeth, and then the doctor would like do something with her fingers. Yeah, so basically the dentist was new to putting sealants with Fuji. She told me to go grab Fuji for this pediatric patient. So I go into the cabinet or whatever with Fuji, and I grab one and I look at it and I'm like, oh, it looks kind of weird, like the packaging, but I'm like, whatever, like it's probably nothing. It's probably my memory, because I have bad memory, guys. And I've only I only had ever received Fuji. Like the other dental assistants I was working with have only ever given me the Fuji to give the dentist. I had never gotten it from the cabinet myself, but I knew where it was. So anyways, I grabbed the Fuji and then I load it up, I'm squeezing the thing, and then I give it to the doctor, and then she starts squeezing it onto the pediatric patient's mouth, and I start to freak out because when she's squeezing it, it's not coming out white. It's coming out orange. And I'm like, it has never come out orange before. Why is it coming out orange right now? And I was like, did I give her the wrong Fuji? I was like, was there more than one Fuji in the cabinet? This is a pediatric patient, guys. So as soon as she places the first one, I ask her, I'm like, is it supposed to be orange? And she's all like, yeah, it sets white. So she does so many teeth, guys. She does so many teeth with that orange Fuji. And she leaves. And I'm like, is it really gonna turn real white? Man, oh my gosh, guys. This pediatric patient was so happy. I gave her her goodie bag and I was like, okay, well, you have a great day. And then storms in the doctor, and I can tell she is not happy. And then she's all like, put that bib back on this patient. We're gonna have to dig out that Fuji. And I was like, oh my gosh. She's all like, you gave me the wrong Fuji. And I was like, oh. I'm like crying on the inside, guys. I'm crying on the inside. Good thing her parent was not in the room, because I don't know what I would have done. Basically, we put the pediatric patient back, and then she has to start digging the orange Fuji out of those teeth. And it's a long process, and this pediatric patient is getting obviously like distressed. I don't know if you know how it feels to mess up so badly, to mess up so many times continuously, but it sucks for the patients because we're supposed to take care of them. Like as a dental assistant, we're supposed to take care of the patients. We're supposed to be their advocates. Doctors are meant to do the work, but we're supposed to like comfort them and I just feel so bad the times that I let these patients down, That's why like every morning, every night I pray and I tell God, I'm like, please guide my hands at work tomorrow because I do not want to make any mistakes. I don't want to do anything bad to any of the patients because the doctors rely heavily on the assistants. And if you mess up, they mess up too. But do you have any dental assistant horror stories? If so, leave them down below. I would love to read them so that I won't feel like a total failure. So yeah, that's it for me. Make sure to hit that like button and subscribe and click that notification bell so that you can get notified whenever I post a new video. I'm starting to post them every single week. I don't know if you have noticed. So anyways, bye!